everyone. I'll give an update on new case numbers and hospital numbers, and then I'll run through changes to our testing regime. There were 550 new cases of COVID-19 in the Northern Territory in the 24 hours to 8 p.m. last night. There are currently 24 people with COVID receiving care in Territory hospitals. This represents about 0.8% of our active cases. 18 patients are considered acute admissions. 1 person is in ICU in the Royal Darwin Hospital. The ICU rate represents 0.04% of active cases. 214 of the 550 new cases are from reported rapid antigen tests. Overall, there were 2,594 PCR test results in the Territory to midnight last night. Active cases now stand at about 3,000. The outbreak in Yuendamu is now at 24 cases, but these are all among identified close contacts. The regional test, trace and trap is working, and that's continuing to be supported by the lockout. We've also seen a modest increase in vaccinations in Yuendamu over the past few days. There is a concerning number of cases in the community of Amungana with 16 active cases. They have a pretty good vaccination rate, but to help control the spread, Amungana will enter a 5-day lockout from noon today. This means unvaccinated residents in Amungana may only leave home for 4 reasons: medical treatment, including testing and vaccination, for essential goods and services, for an hour of exercise while wearing a mask, to provide care and support to a family member or person who cannot support themselves. Right now across the Territory, our priorities are having measures in place, like the mask mandate and the vaccine pass, so that daily growth in numbers stays fairly controlled, making sure our health system can handle the increase in cases, getting lots of tests done as quickly as possible. At the moment, all things considered, the growth in numbers is fairly controlled, though it is highly unlikely we have reached our peak. We do not have a high proportion of severe cases, which indicates our high vaccination rate is doing its job, and our testing numbers are high. So we believe we are catching a large proportion of positive cases, which is good. But we want to make sure tests are taken quickly and test results are returned quickly, so that people aren't waiting any longer than they need to know if they are positive, and so that people aren't stuck in isolation any longer than they need to be. What has become clear over the last few weeks is that speed gives us an advantage over Omicron. The increasing use of rapid antigen tests has been a good thing. Territorians don't have to wait as long to get tested, they don't have to wait as long for a result, and our health experts can get a quicker idea of the caseload that we are dealing with on any given day. While PCR testing will still be used where clinically appropriate, we're announcing some changes today that will expand the use of rapid antigen testing so that Territorians aren't stuck in queues or stuck in isolation any longer than they need to be. From today, you will no longer need to get a PCR test to confirm a positive rapid antigen test. A positive rapid test will suffice. Positive cases during their isolation will no longer need to take a final PCR test before exiting their isolation period, so long as they are no longer symptomatic. And if you are a close contact, you can now take a rapid antigen test in your first 3 days of isolation instead of needing to take a PCR test. Also, we're issuing a new direction today, making it mandatory for people to report a positive rapid antigen test through the COVID website. Failing to report a positive rapid antigen test will be a breach of the direction and a $5,000 fine. Over the past week, we have been incorporating rapid antigen tests into our daily reporting and decision making. We are now confident they can do the job we need them to do at a larger scale. While they're not as accurate as PCR tests, rapid tests are still pretty accurate. And importantly, they are generally more sensitive the more symptomatic you are. So when you're at your most infectious, the rapid antigen test is at its most accurate. At the scale we are at now, with 100 new cases a day, the margin of error of rats are not a big issue. Back in the early days of outbreaks, where 1 or 2 cases was the difference between staying open or locking down, being 100% sure about case numbers was super important. Now we are beyond that, and it's more important that tests be as quick as possible. If you are symptomatic, but your rapid test comes back negative, the best thing to do is still stay at home, you got something, and take another test in 24 hours. After all, whether or not it is COVID, you are sick. We are making these changes today because we don't want Territorians to have to go through what people elsewhere went through over Christmas and New Year. We don't want you stuck in queues for 8, 9 or 10 hours waiting for a test, and we don't want you stuck at home for 5, 6, 7 days waiting for a result. This is how we manage COVID, keeping Territorians as safe as possible while still letting Territorians get on with their lives as much as possible. Thank you.
Good morning. Thank you, Chief Minister. Marco Briseno, Deputy Chief Health Officer, providing an update on behalf of Health. I'd like to sort of acknowledge that our number of cases have remained steady, even though we see an increase of cases every day. It hasn't been peaking the way we were fearing, so we are comfortable with that. And more importantly, the number of sick people in the Northern Territory are not getting sick to the point that they need hospital care, and our hospital system is holding steady and being able to provide care for Territorians. There's only one patient critically ill in ICU and remains stable, and we wish that person well, but we haven't seen increase in ICU admissions or needs for ICU. I'd like to talk a little bit about what the Chief Minister mentioned, the moving towards rapid antigen testing over PCR, and emphasize that the importance in our case is rapid turnaround of results. We need to know as soon as possible if you have a COVID positive test or not, and being able to offer you the care that you need. In a high prevalence environment like we have today, rapid turnaround of results is more important than the superior accuracy that we were seeing on PCR, which is particularly important in low prevalence settings. So the rapid antigen testing will give us the tools that we need, will give us a quick response and a quick answer to what we're dealing with, so we can provide Territorians the care they need and keep our communities safe. Thank you.
Thanks, Doctor. Thank you, Chief Minister. So specifically to Amungana, obviously with the increase in cases up to 16 today, you will see an increased presence of police. We are currently in the community. We've had welfare support in community for a number of days now, given some positive cases previously. Obviously that will increase, and the welfare component will be managed by the Emergency Operations Centre and currently the Southern Incident Management Team, to ensure provisions are provided to community to limit movement during the lockout. I urge everyone to protect the community of Amungana and Territorians, to heed the advice of police, authorised officers and public health officials. It's really important work, and we have to move swiftly. You'll see an increase, there's a clinic there, an increase in tests, so we can move fast, identify and isolate and protect all residents. I think that at the end of the day, it's up to everyone, the local leaders and the people in community, to do the right thing and help us, and we can move through this 5-day lockout and return to some sort of normalcy. Thank you.
Are we going to address any supply issues with rat tests? A lot of people need them and can't find them at pharmacies.
Yeah. So if you need a rat, for one of the reasons we're asking you to get a rat, then obviously they're available out at East Armsay in the Darwin area. I think we're doing about 4,000 rats a day. So we are providing a lot of rats through there. I think on average we're providing about 12 to 20,000 rats a day in the Territory for free to people who need them. There are obviously some supply issues in the private market. So the next couple of weeks there may be some difficulty for businesses who might want rats within their settings, or people who are worried about whether they need to do a rat test or not. But if you require a rat for the reasons we're asking you to get a rat, so for example you're a close contact, asymptomatic or symptomatic, or anything along those lines, the rat's there for you. So we're giving rats for free to people who need them.
National Cabinet's discussing schools reopening today. Is the anti-government considering delaying that school reopening date?
Obviously we'll discuss that at National Cabinet. At this stage we're working towards Term 1 starting when Term 1 will start. We've got about 3 weeks for people to have their children vaccinated. So we now have a vaccine available for 5 to 11-year-olds. Based on all our looking at the opportunity, every parent will have an opportunity for their child to be vaccinated before school starts. We have now been, close to 2 years in this emergency. Children in the Northern Territory have had as close to as normal a life as possible, I think, compared to any other child in the world, maybe some WA kids, some Tassie kids, etc. Territory kids have basically had a normal life. We want to maintain that. I think it's important that schools are the last things you close and the first things that you reopen. I believe if we can have our children safe and go to school, that's a great thing. In the Territory, we have a capacity for our children to be safe and for them to be able to go to school. So for me, unless advice I receive changes, we're working towards school term starting when school term starts.
You mentioned that figures are quite steady, as in UK's figures are quite steady, but we're still expecting a peak. What is that peak and when are we expected to hit it?
So might be a question for Dr. Marco. We're obviously holding steady around 500 cases a day. How you calculate the math on what the peak is difficult. It's not pure. There's a lot of work that goes into that. What we've concentrated on is can we keep the curve flat? And at the moment in the territory, we've essentially flattened that Omicron curve. It's too early to say it's definitely flat, but we have certainly flattened it. And active cases are being maintained at a consistent rate, which is great. And we know that, at the moment, lived experience, 500 cases a day equals X hospitalisations, and we're able to deal with it all. I might pass to Dr. Marco to see if he can add to that. It'd be fair to say that our work within Sensi though is about doing what we can to flatten the curve as opposed to work towards a peak.
Thank you, Chief. The modeling that is used to analyze a peak curve is complex, and some of the modeling that we have had is based on Delta, and now we're dealing with mostly Omicron or a combination of Delta and Omicron. So some of the assumptions that we were making need to be adjusted to the new situation. We have seen since Christmas a tenfold increase in cases, but we haven't seen that continuing for the last week. So the last week we have plateaued in around 500 cases a day. So we are not seeing that duplication or even or exponential increase on cases. So as the chief explained, it's early to say that the curve has flattened, but there are some signs that appears to be the case.
What are vaccination rates like in Yuendamu, and have we seen an improvement in those figures since the health team said they're trying to boost those vaccination rates there?
Yuendamu has a first dose rate below 70%, so from memory it was in the 60s, and a second dose rate in the 40s. We have unfortunately not seen a take-up in vaccine in Yuendamu like we saw at Rockall. Well, Rockall was always very high. In Pijari is probably a better example. We saw a massive take-up of vaccine in Pijari. The last device I had, we'd had 36 additional vaccines delivered in Yuendamu, which is good, but not a lot. In other places, Western New South Wales, parts of the territory, you essentially saw everyone take up a vaccine. So over half the community said yes, so over half the community's first dose. So you can't describe Yuendamu as an anti-vax community. What you can probably say is there's a strong element within Yuendamu who are resistant to vaccines. It's their choice. And the previous experience almost anywhere else is as soon as there's a case, people will change their mind on what a vaccine. We now have cases in Yuendamu. People aren't changing their mind in considerable numbers. So there's vaccine there. We've got vax teams there. The priority now in Yuendamu is testing. If people aren't saying no to vaccine, we'd possibly be twinning it. So the effort in Yuendamu is more focused on the test, trace and trap. And so far the positive cases and close contacts are the ones turning positive. So the test, trace, trap is working in Yuendamu. We've had to adjust our response rate to Yuendamu essentially based off what the community response is.
Of today's new cases in Yuendamu and Yuendamu?
The new cases today were in Mungana, were the ones that concerned us. That's why the lockout. I've double checked my notes, but from memory there were a couple of additional cases in Yuendamu, but not all within the close contacts. I can't remember the exact number, but they were within the people that we had identified already as a close contact and therefore likely to become positive. Do you have?
I don't have any information.
Will you be changing the close contact isolation requirements for any more industries or workers?
No, at this stage. That was a very expansive list we put out the other day for essential workers. We are discussing that further today in National Cabinet. In COVID, never say never, but that was a fairly expansive list put out the other day for asymptomatic close contacts who could return to work if they're essential for that work to keep operating. So it's still a pretty tight bandwidth. We prefer you as a close contact to stay home if you can, but we recognise in some settings for some workplaces, if that worker doesn't go in, then that work doesn't open. And sometimes it's really critical that the store is open, that the police officer can attend work, that the nurse goes in. So we've got that rule there for that.
So will you make rat tests free for those Coles and Woolies workers that can't find them?
No, so this is both a national decision and a local decision. Coles, Woolies, more than capable of providing their rats. Coles and Woolies haven't asked us for rats either. If you're a third party out there, we need you to find your own rats. Again, in the next couple of weeks, it may be hard. And if there are exceptional circumstances, So, you know, a remote community store hasn't got access to rats and needs to stay open, then obviously we will consider what we do in those circumstances. So we're not, it's not a hardcore no, but by and large, if you're fully vaccinated, asymptomatic, close contact that requires a rat on that day, then that's in the hands of the employer.
The CLC and Congress are calling for supervised isolation communities in remote communities. Is that something that the government's considering?
As I understood it, supervised isolation was something that was occurring in remote communities. Maybe there's a context thing I'm missing there. But each community requires a slightly different response because of the nature of the community, distance away from an urban centre, something like that. So you look at Binjari, that was 50 minutes out of Catherine. So our response to Binjari in many respects will be different to a response in Yuendamu if you look at the distance involved. As I understood it, depending on the positive case or the close contact, different decisions will be made. Supervised isolation is one of the options that we have. Are you aware of anything else on that, Dr. Bresciano?
Yeah, I can probably expand on that. We are finding ways and increasing avenues in which people can safely isolate or quarantine closer to home. Now, the balance that we need to strike is that keep the community safe from public health perspective, while we ensure that those individuals that need to isolate and quarantine and doing so safely as well. So we're trying to put on the table all the options that we have, which include the CNR here in Darwin or the TOT facility in Alice Springs, but also will include supported accommodation in some regional centers, will include assistance for people to do that at home if they cannot do it by themselves, or guidance as to how can be done safely.
You've announced that failure to declare a positive rat will be punishable by a $5,000 fine. We have people buying medical cold woolies, we've got them coming from East state-run clinics, we've got them getting them from the airport, God knows where else people are collecting their rats from. How are you actually going to enforce this rule if you're not sure where the rats are going?
Yeah, I think I'll pass to Acting Territorial Controller here. The circumstances which we will know that you haven't declared a positive rat is where you're symptomatic, you've taken a rapid antigen test, you know you're positive. If you stay home, that's great. If you go out and you pass it on to somebody else or something like that, that's when it's going to come to our attention that you've had a positive rat and haven't told anyone, and that's where the fine will kick in. I think we see the natural circumstances that would flow from when we would be aware that you've had a positive rat and haven't reported it. And I'll pass the Acting Territorial Controller to talk to that.
Thanks, Chief. So there's probably two tiers in relation to this. There's the people uptaking the rats when they enter the territory or just undertake a rat, and they've got a obligation to report it and upload onto the portal. I think the last time I was briefed there was about 1,300 indications, and there was a high compliance rate. So it's about doing the right thing. It's doing the right thing for Territorians. It's doing the right thing and complying with the CHO's direction. The CHO direction is law. You need to comply with it. If you don't comply with it and you come across and you're given a rat and you don't upload it to the portal, you're in breach of a direction. The second one is, as the Chief highlights, if through investigation and contact tracing we identify people who are positive and having a risk on community, haven't declared it or uploaded the correct information, they'll be subject to a $5,024 fine.
Just to clarify though, I understand that it's now positive cases' responsibility to inform their close contacts. Is the Territory Government still monitoring close contacts?
So we've got the stop and stay. So the stop and stay alert will go out, and then people, they are obliged to tell them they're a close contact, and the close contacts then have an obligation to undertake that duty as well and upload the information to the portal. And it's an obligation on people. We've seen an increase in numbers, we've seen it across the nation. It's a high demand on contact tracing teams. There's an obligation on the person to do the right thing, their civic duty to protect the community. It's really simple stuff.
Should Territorians be getting an automated text message though if they have been exposed to COVID?
Yeah, so if I can add to that answer, what we're after right now is speed. The most important thing for us as we deal with an Omicron wave is pace. If you are positive to COVID, you sending a message out to everyone that you know you've spent time with is the fastest thing that we can do. So it's all about pace. Rather than transferring responsibility, it's about saying how can we get this message out quicker to people. We're still doing contact tracing. We haven't walked away from that. And we're still doing those automated text messages out to people around exposure sites and all that sort of work. But what we've identified, and this is from the experience down south as well, is if you know you're positive and with your mobile phone can get out to everybody immediately that, oh, by the way, I've just tested, we spent time together, you need to go get tested, that's quicker. So what we're after here is pace. It's just really, really important that people get information as quickly as possible and get tested as quickly as possible. So a lot of the measures that we're looking at and any future measures we're looking at is all about how can we make things just go faster. And that's what we're doing a lot of automation around. That's why we've made some changes to how we're notifying exposure sites and primacy on that text message. The stop and stay is now gone to text message into our website because it's just quicker. We're just working a lot here on how can we just be fast.
Last couple, guys.
So you're relying on Territorians to protect other Territorians?
I think we've relied on that for 2 years, to be honest. One reason why the Territory's been so good for close to 2 years is Territorians. We've done a lot of work. You know, let's not take away from health or police or everyone else. I mean, there's a significant amount of work we've done on the front line. But by and large, if you look at the measures that we've got in place, indoor mask mandates, everything, enforcement of this has basically been Territorians doing the right thing. I know in the Territory, if you're walking anywhere, you weren't wearing a mask, Territorians are basically self-policing that. I've had a significant amount of feedback, I'm sure others have, of people who've gone down south in recent times and have been horrified at compliance and levels of compliance down south. One reason why the Territory has handled COVID so well over 2 years is because Territorians have been exceptional and have looked out after each other. So, yeah, one of the things that we're asking for is if you are identified as a positive case, that you let everyone you know in your circle that you've been spending time with, that they're a close contact, because that's fast and that's going to see us stay ahead of the Omicron wave as much as we can. We've got to be as fast as we can right now.
You've mentioned that businesses have to provide their own rapid antigen tests. Paramedics don't actually have access and they're a contractor to NT Health. Should they be provided as a frontline medical service with rapid antigens by this Territory?
I'll take that on notice what the relationship with St John's is and how that's working. I'm not sure what how that's been handled. Yeah.
I believe it was announced that all visitors to Royal Darwin and Palmerston Hospital would be rapid antigen tests. From my understanding, that's not occurring. Is there a problem with supply at the hospitals?
No, that was a local decision made by the Royal Darwin Hospital leadership. There was actually a national cabinet decision saying don't do that. It was well-meaning, but that was a lot of rapid antigen tests being used for not necessary reasons, is my understanding. So there are measures in place, obviously, to make sure visitation to the hospital is done as safely as possible, but having people everyone queue to enter, and my understanding was taking sometimes people upwards of 1 or 2 hours to get into the hospital and they're missing their appointments, so that everyone did a rapid antigen test wasn't the best way of keeping people at the hospital safe, and it was using, I think, something like 4,000 rats a day. So it just wasn't the, I think it was, I understand why it was brought in, so I'm not critical of that, but certainly now it's been done in practice, it was clearly not the best way of making sure people stay safe at the hospital.
Thanks, everyone. We'll leave it there.
Thanks.